Well, good evening, everyone. I am sorry that we're having some technical issue, but at least you'll be able to see the slides, and maybe um, Julia will advance them for us. And if we're not in sync, we're not in sync, but the objective for this evening is for us to connect and talk about alternative treatments, integrative treatments in Parkinson's disease, and as well as just general health and well-being. So tonight I'm going to talk about microbiome, gut health, micronutrients, supplements, and lifestyle modification. So we can move on to the next slide. Um, Even 400 BC, the father of medicine, Hippocrates stated that our food should be our medicine and our medicine should be our food. If we could give every individual the right amount of nourishment and exercise, not too little and not too much, we would have found the safest way to health. Next slide. We are humans. As humans, we are a walking ecosystem with so many viruses, bacteria, fungi. Next slide. The microbiome has been a topic of discussion for the last 10 to 15 years. Everybody's talking about the brain-gut connection, that it is super important, what we eat. And now with so much more modern technology, we can literally use our microbiome as a fingerprint to help advance medicine and treatment. So what is important about, next slide, the gut microbiota or microbiome? Our well-being depends on it. We really need a healthy, diverse colonies to be able to function um, and have a healthy intestinal lining with tight junctions. So the gut microbiota is 100 times larger than the human genome. One of the important things is that this resident, the microbiota in our intestine, is very dependent for health on plant-based complex carbohydrates. The lining, the mucosal lining of the intestines, is actually made of complex carbohydrate. So when we're not eating fiber, diversified vegetables, pectins, this microbiome, the bacteria will start attacking the lining of our mucosa for survival. So when this is happening, there is adverse reaction and damage to the lining mucosa. This disrupts the tight junction. So the tight junction is sort of like a fence. You need a good fence for good neighbors. So when we have a disruption of the tight junction, this also causes disruption in the brain by affecting the blood-brain barrier. And the problem with increase in permeability is inflammation. Inflammation is the cause for disease. Because we want bacteria to stay on the other side in the intestine and not permeate to affect and leak into the bloodstream and cause a lot of inflammation. So next slide. Butyrate is a main producer for energy. 70% of the colon energy and is supplied by butyrate, which is a short chain fatty acid generated by microbes in the gut through fermentation of undigestible fiber. So we get increase of fiber like pectins, beta glucans, inulin, starches, and you can see from the slide, that berries, fruits, veggies, citrus, fall into the pectins, and mushrooms, oats, barley into beta glycans. The garlic, mushroom, the artichoke, onions, and cold potatoes. And for some people, resistant starches are green bananas. So all of these can help increase the amount of butyrate, which is very essential for the well-being of the colon. But also, this can be supported. What is increasing the gut bacteria producing butyrate can be done with aerobic exercise, omega-3 intake, which is huge, and we'll discuss that more in details later. But what is really important, and has been a lot of discussion about fasting and time-restricted eating. So fasting is, when people are not consuming anything, maybe just water. But what is more of interest is with the time-restricted eating is to have a time of when you're eating and not eating. So let's say you will only consume food from 12 to 8 or 10 to 6. And the rest of the time, you can still drink water, coffee, tea that doesn't have milk, sugar, or any other ingredients. So basically, is like no caloric intake, and there's nothing that needs to be digested. And this actually has been super important for healing of the intestinal lining, which we all need. And also has been implicated for people that have diabetes, which increases insulin sensitivity. So it's a win-win. Next slide. What happens in the industrial world? We are busy. We eat more processed food, bleached, sanitized food, packaged, which is dense in high calories and poor in nutrition.
You don't have to do that now. We're watching this. Okay, I'm gonna.
Hi, can you mute, please? Thank you. So, what causes this industrial eating way of diet, which has high carbohydrate, high fat, low fiber? Also, alcohol can disrupt the intestinal permeability. A lot of people are talking about gluten. You don't have to be allergic to gluten. You don't have to have celiac disease. Gliadin is part of gluten, and what gliadin does in the intestines is releases zonulin, which works on really disrupting and affecting the cell wall, that nice fence that we have with the blood supply, and that we really need to keep that intestinal lining tight and healthy. Also, stress increases cortisol, corticotrophin releasing hormone, which affects and stimulates mast cells, and these mast cells use their proteases to disrupt the tight junction. So I bet you wonder how do we even know if we have healthy microbiota, if we have healthy intestinal lining? How are we feeling? How are we functioning? One test that can be done for testing for gut permeability is lactose mannitol ratio, where a person will ingest dissolved lactose and mannitol, and then collect urine for 5 hours to see if there is an increase in the lactose mannitol ratio to see how damaged or how much permeability there is. But even, it's a 5-hour urine test that you have to collect urine for 5 hours and have that analyzed. Typically, we really don't do that. It can be done, studies, research, but I wish that we can have a simpler test that we can provide for patients to see what is happening with our intestinal and for everyone, permeability or not. Well, one of the things people have talked about leaky gut, leaky brain, insulin sensitivity, diabetes, bloating, pain, constipation, swelling, arthritis, mood, foggy brain. All of these are associated with increased intestinal permeability. And of course, we're wondering how much in Parkinson's disease you get brain fog, pain, difficulties, of course, constipation, slow transit. My patients are asking me, okay, I'm taking my medications. What is it that I can do to ensure health and wellness? And this is extremely important about having healthy gut. So, how can you support your digestion? Next slide. Many people are taking antacids, prescription like medication like Zantac, Pepcid, Tagamet. All of this, are disruptors of the intestinal lining, but also decreases acid in our system. So we need acid in the stomach to produce B12, and without B12, B12 is a very important nutrient. So um, other thing, medications such as metformin can also block uh, the acid, and people are finding that they're B12 deficient. So if you're taking metformin, you're taking omeprazole, please, it's important to check B12 levels because when you're deficient in nutrients, this is going to affect Parkinson's and also other neurological disorders. You could add glutamine, like L-glutamine 1,000 milligrams, to your supplements. What glutamine does, which is really important for patients with Parkinson's disease, it will decrease the craving for sugar. And we know that there is a sweet tooth for patients report that they really like to consume sweets. If you're told that you have low stomach acid, lemon water, organic apple cider vinegar can be helpful. 1 teaspoon, half a cup of warm water before each meal. Other things which are huge are prebiotics. People are talking about prebiotics, probiotics. Now they're talking, the new term is postbiotics, that these are like already pre-chewed and you can get postbiotics as well. So prebiotics, most of us would like to get all of our nutrients from food. Unfortunately, we're not getting freshly high nutrient value in our vegetables and fruits. Most of us really don't even know where they're coming from and how much they've been forced to ripe, um, and the nutritional value. If we can just get it fresh picked in the market, it would be wonderful. Radishes, Jerusalem artichokes, leeks are huge as prebiotics, jicama, asparagus, carrots. One of the things that is used in other countries and cultures like Japan is natto, which is fermented soybean. It has a peculiar smell, taste, and it looks like it's slimy. So, of course, we're not going to jump in to eat it because it looks like it's spoiled when you look at it and it smells weird. But this particular fermented food has been associated with decreasing cardiac issues and also improves bone density because it's rich in K2, and we need K2 for strong bones. So since we don't have natto, and I would like to try it. I've seen pictures. I think other fermented foods that we are more familiar with would be sauerkraut, pickles, yogurt, kefir, kimchi, and kombucha. Kimchi is from Korea. It's a cabbage. It's pretty spicy. So, again, something to consider. Next slide. So, United States has significant nutritional deficiency. Um, the first is in omega-3, which is seafood derived. It's in a huge number, 80 to 90%, or maybe higher. Population are deficient in omega-3. Why is omega-3 huge? So the Department of Health and Human Services, and also the United States Department of Agriculture, American Heart Association, and American Dietetic Association recommend that we have 2 servings of 8 ounces of seafood per week. There are studies that state that low omega-3 intake from seafood has been identified as a preventable cause of death. Why is omega-3 hugely important? Because it's a long chain fatty acid contained of EPA, which is icosapentaenoic acid, and DHA, docosahexaenoic acid. So the DHA component, our brain is 40% DHA. We really need to be fatheads. Don't take it personally if somebody calls you a fathead. I love nice, chubby brain. That's beautiful. If you're a vegetarian, vegan, and do not want to get any omega-3 from animals, you could get the short chain omega-3 fatty acid from flaxseed or algae. Algae does contain only DHA, and but you would have to consume it in much higher doses than you would for the animal source, which is fish. And one of the things that's important is to add salmon, sardines, or mackerel, and to stay away from swordfish because that has been found to have the highest content of mercury. Um, the next very important nutrient is some water. Which is important. But vitamin D, we are like 70% deficient in vitamin D. Vitamin D is a cofactor in 1,000 reactions in our metabolism. Super important. It's an actual hormone that is important. Works in the intestine and in the brain. In the intestine, suppresses serotonin, so there can be more function of serotonin in the brain. So it turns on serotonin in the brain and suppresses it in the gut. And the red blood cells do need that serotonin for aggregation as well. So I would recommend that we need to check our levels. It's hugely important to check our levels for D3. Typically, if you have your labs done at Henry Ford or any of the health system, they will say if you're deficient, if you're less than 30, less than 20 nanograms per milliliter. I would recommend a lot of the research outside of just a medical community would say that 60 to 100 would be a much better marker. People are very worried because this is a fat soluble vitamin that there is toxicity. And I have seen many patients, which I have them on high doses of vitamin D3. I have not seen a single person that has developed toxicity. and you would get a toxicity of, which is, expected to be over 150 nanograms per ml, which I've never met anybody, and most of my patients do take high doses of D3. So if your levels are low, just to increase it by 5 nanograms per ml, you would need to increase the dose of D3 by 1,000 units. The other thing that is crucial also is that vitamin K works with vitamin D. And if you're taking for vitamin D3 to work well, it's also important to add vitamin K2, 100 micrograms. Um, and we have to be aware also vitamin C, B12, folic acid. These are very important. When we are deficient in this, nutrients, there is a significant damage to our double-stranded DNA. So when you have breakage in the double-stranded DNA, there's risk for cancer, inflammation, disease, but cancer in many organs has been associated with deficiency, and especially when we have this breakage in double-stranded DNA. Next slide. I'm going to talk more specifically addressing depression, environmental food allergy, sleep. The next few slides. Many patients are already taking antidepressants, still not functioning. Again, we're going back to the wellness and of our cells, our gut. Do we have enough nutrients? Uh, there are several psychiatrists that have written books that I can, provide information on for many patients that they have treated that did not respond to multiple medications, the standard antidepressant. So what they have found for their thousands of patients in psychiatry, that high doses of EPA, like 2,000 milligrams twice a day, with the addition of vitamin C, 500 to 1,000 twice a day, has made a significant improvement in their mood, well-being, and sleep. What else is important to make sure that when we're looking at, when you're coming in, is to make sure your thyroid function is well, and also what other gastro gut presentation and complaints are present. So Deplin is a prescription folic acid, which is a very high dose that can be added to prescription antidepressants for stimulating, or 40% of Northern Europeans are deficient in metal tetrahydrofolate reductase, which even if you are taking folic acid, if you're not able to add that metal group, it's not going to work. So I do recommend methylated. There's like a methyl group added to folic acid and methyl group added to B12 to make sure that it is absorbed. I mean, it's very expensive to do a testing for metyl tetrahydrofolate reductase deficiency in everyone. So I think this is like pre-done, pre-chewed, already, and ready for absorption. Regardless if you are deficient or not, if it's methylated, you're going to be able to utilize it. Magnesium can be helpful. Of course, it is part of 300 reactions as a cofactor. Typically, we need like 400 to 600 per day. One of the things is that recommended daily allowance is 2 standard deviation above deficiency. And I think this is just a safety. It's a guideline, not necessarily written in stone. And I think there's a lot of individual variability of what is normal and what a person actually function and feels well on. Next slide. So, when I see patients and we're kind of looking, my approach is to do an integrative approach. So, integrative approach is sleep, food, wellness. How can we look at all possible interacting factors in wellness? Um, if you're having multiple health issues, diabetes, high blood pressure, cholesterol, pain, arthritis, swelling, constipation, so it would be beneficial to do an elimination diet to really remove food that has been highly associated with inflammation. Well, one, we know sugar. There's no nutritional value. It's just it's the worst. It's worse than crack cocaine in how much it damages the intestinal lining and causes um, um, permeability. A lot of people are allergic to egg. They don't even know. They may not be allergic in a sense that you're going to die and form an allergic reaction of being swollen, not being able to swallow, but you may be sensitive where it doesn't work for you. I mean, it doesn't make you feel good. I would recommend that you do 1 month or 2 months where you are, depending on the health. If your health is really not good, do the plant-based diet. I have many patients that were not able to tolerate any Parkinson medications, very stiff, very rigid. Once they were on a plant-based diet, their body adjusted, it healed, and now they're tolerating and actually getting a benefit from the standard prescription medications that we use in Parkinson's disease. Um, Patients that they need some iron in their system but are unable to tolerate iron can use stinging nettle in capsules. This is a natural plant like eating spinach, but it has higher concentration of iron and it doesn't cause constipation. So overall, I love quercetin. It's an antihistamine, anti-inflammatory, and actually, what it does, it helps with um, uh, mobility, flexibility of our blood vessels. And I love it as a allergy medication. If you're taking Benadryl, it's going to make you sleepy. It's anticholinergic, where quercetin doesn't cause any of that dry eyes, dry mouth um, concern. Other allergies. Next page would be next slide would be um, cow milk. They believe that cow's milk is really just for their babies, not for us. Again, many people are lactose intolerant, or sensitive, not necessarily diarrhea, but severe bloating, gas, pain. Um, I would, again, it's the same like elimination and really paying attention or maybe doing a diary of what you're eating. Unfortunately, with food, when you eat something, if you don't have a severe allergic reaction, you will not know that this is not good for you because you may feel the consequences and the sensitivity a day after or 2 days after or even 3 days after because it just depends of release and digestion and inflammation. It takes some time. So maybe having a diary or starting on a plant-based diet for a couple months and then adding one thing at a time and just really looking to see how do you feel. Next slide. Sleep is crucial. We regenerate, we heal during sleep. Um, One of the easiest thing to do would be to really use bedroom just for sleep and sex. No electronics, and to actually have a schedule of going to bed maybe at 10 o'clock, making sure you haven't eaten, in the last 2, 3 hours. So There is no competition because if you're going to bed late, this suppresses insulin, and it's causing more insulin resistance and sensitivity over time. And it does mess up with your melatonin innate production. You could add melatonin at bedtime, but there's a lot of patients that have reported that taking it 4 hours before bedtime was more beneficial than actually taking it at bedtime. Again, you need good levels of omega 3. It's interesting that Japanese have 5 year longer life expectancy than Americans, and their omega 3 index is more than 10, and our omega 3 index is 4 or less. You could add valerian root as a tea, passion flower, chamomile, warm baths, um, um, GABA 200. These are like different things that we could look at to see, what may be beneficial and helpful. Next slide. We'll talk about erectile dysfunction. Be part of the non-motor symptoms, can be part of aging. Again, wellness and health, making sure that cholesterol, sugar levels are people that have diabetes, they need to have a really good control of their diabetes, and probably uncontrolled diabetes should be on a plant-based diet. Um, no alcohol, physical activity. Um, some people feel that we benefit more exercising in the afternoon instead of the morning. Again, is getting to know your body and seeing how are you feeling mostly refreshed and functional, morning or afternoon exercise. Arginine, 500 milligrams twice a day can be helpful with ginseng. But again, looking at all of supplements and everything, I really, it's important to have a good comprehensive understanding of what the patient is taking and what we can add that would really complement and address everything in a way that does no harm. Fatigue is part of all neurological disorders all across the board, in particularly seen in Parkinson's, MS. Um, NADH, 5 to 10 milligrams. Again, sleep is huge. Take a nap if needed. A lot of people need a half an hour, 1 hour nap. Magnesium, potassium aspartate in low doses, again, can be stimulating. And again, see if exercise in the morning is more invigorating than exercise in the afternoon. Hydration, hydration, hydration. I cannot emphasize this enough. A lot of people don't like drinking water. There's so many non-motor symptoms, again, like orthostatic hypotension. Like if we just added more water and added Celtic salt to that water, like maybe quarter teaspoon in 12 ounces water, we may not need to medicate to reach a good blood pressure level. And especially when people are, passing out from sitting to standing and changing in position is quite worrisome. So if you don't like your water, maybe you can add some flavors. You can add basil. It has a really nice flavor. You can throw in some cucumber, fruit, citrus, lemon, lime, anything that will encourage you to drink more water. So typically, I would recommend at least 2 liters uh, minimum, if not more. Next slide. Again, other people have used licorice, which can be helpful in orthostatic hypotension, Siberian ginseng, um, is related as a precursor to DHEA and cortisol. Again, we can test so many different things, but again, going back to the well-balanced diet, water, keeping it as simple as possible. High cholesterol, next slide, treatment. Um, Either red rice yeast can be used instead of statins. Some people find statins are very difficult to tolerate. There's muscle mass loss, there's muscle pain, wasting of the bigger leg muscles. Um, so they may choose to use either statins or red rice yeast and see how that may work for them. And again, plant-based diet will it's huge on function. You can add flaxseed, cook with avocado oil instead of other oils because it can withstand higher temperatures. Um, Omega-3 and plant-based diet. We actually have Lavazza was a prescription which has DHA and EPA, and you can get that as a prescription to decrease triglycerides. And then they stopped covering it, and now they want to charge $150. So if they want to charge you $150 for Lavazza, then I would recommend that Nordic Naturals would be it's an excellent company. It's from Norway, tested for mercury and pro omega 2 capsules twice a day would be a great choice for omega 3. Next slide. Constipation. It's a huge issue. Magnesium citrate, gluconate is very helpful, and sometimes we need to push it until you get a diarrhea, and then you go back and see how you function with that. Swiss Chris, it's almost like a Swiss kiss, but it's not. It's an excellent herbal laxative that has only 8.5 grams of senna, and you could take it every day without any issues. We've talked about the benefits of probiotics, and we want to make sure that it's a good quality probiotic like Garden of Eden that is refrigerated, and it's more than 50 billion and more than 30 strains. So another thing that I have found very helpful, and now with this whole microbiome, is how can we test to see if our gut is healthy? So Viome is a company that you can order your kit online, and then in the privacy of your home, you could send a sample of stool and also blood to for complete analysis to see what you should or should not eat based on what the bacteria in your gut is able to um, digest. I have many patients that have done this, and actually they have a regular bowel movements every day because they know exactly what to eat and what not to eat. And the investment for the Viome would be, I think it's like $200. It used to be 50 for the test, and of course it's very popular, and so many people are using it. The price may even go much higher, unfortunately. Next slide. Just wanted to, make sure that um, again, you have a physician that understands traditional and integrative medicine. They could help you navigate through this. So my role as an integrative neurologist is to give you all the options and empower you to think for yourself and decide what really resonates with you. How do you want to lead your life? Um, because you get to decide. We are your consultants. This is something that I'm passionate about. I am very interested in integrative medicine, and I find my patients are doing extremely well. Maybe because I get the best patients, they're very invested in their well-being, and they read and look at all these different things that could help them, and are very much aware of how their body is functioning. Next slide. What is the future of medicine? I believe that we're going to have microbiome engineers that are going to really look at our microbiome as the ideal test of wellness and health, and how to achieve more colonies, more healthy gut for overall well-being. So one of the things is we're looking at health quality versus longevity. What happens when we're deficient in all these nutrients? All these nutrients are going to be utilized for survival in the moment, possibly survival and reproduction. But the cost, again, is if we're using all these nutrients and we're deficient, we're shortening our life and long-term development of diabetes, cancer, and other preventable diseases. New slide. So if I could make any recommendations to keep it simple, I would say that wellness is really back to Hippocrates, being our food is our medicine is our food. It's super important to have 30 grams of fiber per day, sometimes more. Seafood twice a week, wild salmon, sardines, and mackerel. Stay away from swordfish because of high content of mercury. And again, look at some tuna if they're being tested, for mercury. Fun, brisk walk. One of the things that is very popular now is gratitude. If we can write 3 things every day that we are grateful for, in 2 months, depression is going to lift just by doing that one thing. And this is from Dr. Daniel Amen, and who's a well-known psychiatrist, and he does many PBS talks. As I said earlier, I really like Nordic Naturals. They're certified clean, and Pro Omega would be probably, or Ultimate Omega would be the highest in EPA and DHA. Vitamin D3, 5,000 per day with 100 micrograms of K2. And if you are feeling really bad, you're coming up with bacteria, virus, something, you're not feeling well, you could literally take 50,000 of vitamin D3 for 5 days without having any issues that will totally interrupt whatever infection is going on. As I said earlier, I like the methylated folic acid and B12. If your health is at issue, you don't feel well, give your body a chance to rest, and consider the time-based, when are you eating, when is your body resting. Consider eating for 8 hours and not eating for the rest of the time. And check your levels of B12, vitamin D to see what else you may need. Next slide. I just want to thank you all for your patience and understanding about technical issues, and hope you could see the slides. I just want to close with that I believe our mind is huge. It just believes what we tell it, and unfortunately, a lot of times we tell hopeless stories of being a victim, and there's nothing to do, and there's nothing that can be done. There's always something that can be done to improve quality of life. We need to tell our mind some better stories of courage, adventure, support. And I encourage you all to stay open and curious and get to know your body and what you need. And I wish you love and to give love and to be loved. Thank you so much.
Thank you, Dr. Krstevska. I do feel as though I need to give you a proper introduction, as I did not, seeing as how we were trying to figure out our IT issues. So before we take any questions, I just wanted to let you know that Dr. Shana Krstevska is a medical doctor that is a movement disorder specialist, neurology, and she completed her fellowship under Peter Lewitt and has been at Henry Ford for over 20 years. Don't know the exact
About
number.
20 years, yeah.
And
give or take, and I'm still 40, you know.
Yes, well, I'm right there with you, seeing as how I was there with you for day one. So you're right.
Exactly.
It's only been 5 years.
Yeah, exactly.
Anyways, I'm happy to take any questions either via chat box or if you want to unmute yourself and ask any questions, feel free.
Is there any way that we could get copies of the slides?
This presentation is being recorded and will be uploaded on our YouTube channel. If you're familiar with our YouTube channel. In fact, every program that we do is recorded and is on our YouTube channel. So you can search Michigan Parkinson's Foundation in YouTube, or if you go to our website, in the top right-hand corner, you'll see a box with an arrow, and if you click on that, that will take you right to our YouTube channel.
Okay, thank you very much.
Sure. Any other questions?
Hi, I have a question regarding, just to clarify, if we wanted to understand our omega-3 levels and our D3 levels, what is the name of the test that we would ask our doctor to include? Is it an omega-3 index test? And
yes,
a
omega-3
D3
index.
Okay. And so they'll just add that, for instance, at our checkup, they can add that to our normal panel that we would get.
Yes.
So that's along with that D3 test. The D3 though is vitamin D. When I see a vitamin D line item on my blood work, is that the same thing as a D3 test?
Right. Yes,
Okay.
It's the 25 hydroxy vitamin D. Yep.
Okay, anyone else with questions?
So I have one more. Maybe.
Oh, I'm sorry, Nancy. I didn't mean to cut.
No,
Go
you
ahead.
didn't. It didn't. I just thought of it because it may not be appropriate. But Dr. K, I just was curious. You know, this is such a, and I can't think of another way that you would have presented this. I mean, it was excellent. But you know, if you don't necessarily have, I'm just making this up. If you don't really have a constipation or an anxiety issue, or you know, maybe some of the other big hitters, if you don't have those, I was going to ask you, generally speaking, not too personal, but what do you take on a you know, more regular basis? If you just wanted to have a nice regimen that wasn't comprised of, I'm exaggerating to prove a point, 20 different supplements, what would you do?
Yeah, right. I mean, one thing, you know, I could say if you wanted a really, really good supplement that has everything, that addresses issues for memory, a really good compound of omega-3s. It's called Max Brain, and it's a red box. You can order it online, and it is created by Dr. Daniel Amen, Amon. He's an MD psychiatrist. He does a lot of PBS talks, and this is his company, and I've looked at all of the ingredients are amazing. So you get a packet, one in the morning and one at night. It can be expensive, like maybe like $100 a month, but you have everything. If you think about like buying everything individually, I think it will like cost you more. I mean, it may be 120, depends. It has your methylated Bs, your methylated folic acid. You have your good EPA, DHA, cholines, NAC, all of the good vitamins. It's got good vitamin D3. It has everything there. You just take a packet in the morning, you take one at night. I mean, I think if you could, I mean, some people think it's too expensive. So then, you know, you can still get Nature's Bounty from Costco. Literally, you can get a methylated B12 for $20. It will last you a whole year. And it dissolves in your mouth, and you can pretend it's your little cherry dessert. You can get a Nature's Bounty from Costco, again, D3 5000, which again will last you like 6 months for $20. I mean, these are some things you can buy stuff individually, like you may save on the B12 and D3 from Costco. You can get the CoQ10 from Costco because people that take cholesterol medication, it's pretty inexpensive there. Again, you probably may get 500 for $25 or, you know. So you could get the Nordic Naturals. I think they're like $40, you know. So I don't know. I mean, you may cut the cost by, you know, 2/3 by kind of looking and buying all these individual things and getting it. So what I do like, I like to keep my D3 separate because sometimes I take more. And especially if, you know, people that are overweight, that D3 is going to stick into the fat tissue. So most people might need 5,000. Let's say somebody's taking 5,000, but they're overweight. And when they test their level, it's very low. So you need 10,000 or 15,000. Again, the point is individual assessment of what you need.
I don't mean to monopolize the conversation. If anyone has another question, just jump in ahead of me. But Doctor, have you ever, there's a group of people in our PD group and then others certainly across the country that have taken a supplement that's been around for, I think, 20 years called Restore Gold. Have you ever heard of it?
Oh.
It includes the vitamin, whatever, nutritional element of TUDCA, which is kind of interesting in the work that's being done associating it with other neurological conditions. So I wondered if you had any knowledge of it or opinion.
Actually not, but what is it, PANCA or?
The actual supplement is called Restore, RESTORE.
Oh,
Gold.
Restore Gold. Yeah, I have looked at it, but I think you have to take so many pills. Yeah, I'm aware of Restore Gold.
Yeah, you do have to take.
I mean, I have patients that are taking that, and I recommend it to some patients, but they find that you have to take like so many, and it's too expensive for them.
Yeah, it can be.
You know,
Okay.
but you have to be aware of it.
They know, so they don't.
I would like to say something about it. I use this drug and it didn't help at all. So everybody is different. It may help you, it may not. I used it for a long time. It didn't help at all. It was very expensive.
So thanks for the input.
You're very welcome.
Yes, thank you.
Any other questions? I know that we're, given the fact that we had IT issues and all, we're right at the 8 o'clock hour. So I did want to thank you very much, Dr. Krstevska, for sharing this information. I know that maybe people in the area might know you as the nice blend of Eastern and Western medicine and holistic approach, which is in high demand by many people at first. So thank you so much for sharing all of this. I just want to encourage everybody to keep staying tuned to our third Tuesday educational series. Next month is not one that you want to miss. Susan Woolner, who is works at St. Mary's Hosting in Grand Rapids, has a fabulous talk about using technology to manage your disease. And Susan gave this talk to my support group in Livonia probably about 6 years ago. And it's funny how 6 years ago I was so resistant to many things. And now I have them all over my house, like Alexa, who will start talking if I call her out too much. But there was she was very forward thinking back then. And so I'm very eager to see what she brings to the table. So that will be the third Tuesday of next month at 7 o'clock, and God willing, we won't have any IT issues. So
because she's so much into IT. I mean, I don't know, Julia, we'll have to meet and resolve this issue, because there's so many other things that I wish, I'd like to share and be, more involved with the Michigan Parkinson Foundation. And of course, I love you. I've known you for many, many years, and I love what you do for the patients, for the physicians, for everybody. So my love to all of you, and thank you so much for this opportunity.
Thank you very much,
Thank you very
Dr.
much.
Thank you.
Krstevska.
Thank you.
Thank you.
Thank you.
Good night,
night,
everybody.
everybody.
Thanks for joining.
Good night.
Good night.
Want to see something really fun?
Turn it off.